I'm Robert Benjamin Saldana, board certified emergency medicine for about 20 years now. In emergency medicine, this is what we do, it's disaster management. It's in our bones to be prepared for this. The concern that we as providers in the emergency department have is that we have, of late, seen that patients are avoiding or delaying their care with concern that they may expose themselves to COVID. Patients seem to be delaying their emergencies and presenting not only with maybe an acute stroke, but complications from those acute events that they waited with at home. So this is one of those typical patients in the community that have symptoms of heart disease, but have been delaying care into the ER. She's got, leg swelling, chest pain, some shortness of breath on exertion, which is kind of classic cardiac symptom for heart attack or congestive heart failure. All those things that could, with delayed care, become life-threatening if they aren't already. And she's been delaying coming to the ER. You're now looking at our entrance into the main emergency department. Ambulance will enter here. Patients will also just walk in. They'll first meet a greeter here, which will kind of take a look at their vital sign, get them registered so we can put them into the triage area. Family will be screened at the door. Moving forward, we've decided to limit visitors. Limiting visitors kind of allows us to avoid the unintended consequence of infecting others. Families and patients have been kind of amenable and understand that that's a current requirement along with the social distancing. After the patient is registered to the ER, they'll come in contact with a nurse who's going to do some evaluation. This area of the ER we've kind of set apart so we can have kind of a HIPAA-compliant conversation with the patient, take some vital signs, and start with what we call an acuity to decide where in the ER this patient needs to be placed. Depending on what we call the acuity, the severity of a patient, after they're triaged, they will either be in the hallway waiting, depending on the volume, or come directly to one of the rooms where a provider will come. As you can see, we're respecting social distancing with how we have people placed. This also allows us to kind of have conversations with patients as they're waiting, reassess, give them follow-up. This is a hallway that enters from the main lobby and the valet area. As you can see the signs, there'll be some questions, a temperature taken, and then this is where we kind of split. After the screening process, if a patient is suspected of COVID, then they'll come into a bifurcated or a separate area in the ER where there's a dedicated staff. That staff in respirators with appropriate PPE. In every room, we have air scrubbers, a little noisy, but allows for a negative pressure room for respiratory isolation. And so it's a lot safer for patients to be evaluated there for themselves and the staff than in what we call the cold zones of the ER, which are patients that we're seeing that don't have suspicion for COVID. I would just caution people that if they have symptoms of heart attack, stroke, early fever, and have comorbids, they definitely should not wait on their emergencies. We're open, we've always been open, and we're ready.